Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a functional medicine practitioner, maternity pediatric chiropractor, and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today, we're focusing on the topic of optimizing female and male fertility, and my special guest is Gabriela Rosa. Gabriela Rosa is a renowned fertility specialist, reproductive health educator, and Harvard University awarded scholar. She's the founder and CEO of the Rosa Institute, which is the world's first virtual and holistic fertility clinic, serving patients globally. Gabriela's innovative methodology addresses biochemical obstacles to help couples overcome infertility and recurrent miscarriages. With her team, she has educated over 140,000 couples in more than 110 countries. She also hosts the TalkSex with Gabriela Rosa podcast. For more information, you can check out her website at fertilitybreakthrough.com. That's fertilitybreakthrough.com. Hi, Gabriela. Welcome to the show. I'm very excited to have you on today.
Thank you so much for having me, Laura. Lovely to be here.
So we're going to talk about a topic that you're very passionate about, and that is optimizing fertility. And this episode is about optimizing female and male fertility because they're both equally important, right?
Absolutely. I think that, one of the biggest fallacies of fertility or infertility, as typically patients who come to me are struggling with, is the fact that it's a one-person situation. It never is. I like to say that fertility is a team sport. So yes. Absolutely.
Okay, that's awesome. And we've had some fun guests on recently that have really focused on preconception health and fertility and everything about sexuality with fertility, and then also just really lifestyle modifications and how doing that before you even try to conceive, how that can impact fertility, right? Because I think a lot of times, I see this in my practice and you might as well, people have already started trying to get pregnant and have been unsuccessful for months or even years. And then they're looking for help. But in an even more preventive place, we can do preconception, meaning you haven't even tried conceiving. You have no idea if there's any challenges. You're just getting everything cleaned up from a lifestyle perspective as both partners before you start getting pregnant. So I think that's also an interesting differentiation. Do you have people coming to you for preconception as well?
What's fascinating as you're talking about that, it kind of sent me back to the early days of my clinical practice. I've been doing this since 2001. And in the very beginning, I was very much about, trying to help people be the healthiest version of themselves to get pregnant and really focus on that preparation, because as you know, a lot of times when people get pregnant, the first thought in their mind is, oh, is my baby going to be healthy? And it's almost an afterthought. Whereas what we know for sure is that by 8 weeks gestation, we have a baby who essentially has all its little organs, all its little prints. It is pretty much, developed, and it's going to continue developing for the rest of those months. But the time, I always say to my patients, the time to optimize a child's health is not when we finally find out we're pregnant or when we surprisingly find out we're pregnant. It's actually months and months and months before, and sometimes a lifetime before a pregnancy is even in place or you see a positive pregnancy test. So in the early days of my career, I used to see a lot of preconception preparation and people who were, kind of just wanting to either just start trying or wanted to just really kind of optimize their chances. But as the years went on, I think probably about the 7-year mark of me doing what I did, I got a couple come to me and they essentially were like, we haven't conceived in 10 years of trying. And, we want to do our last IVF cycle. They had multiple cycles that didn't work. And we wanted to help, your help to prepare. And I was kind of like, what? Because, up until that point, the cases of infertility that I had dealt with were early on, infertility. And so when that that couple came to me and they were asking for something that was, kind of in my mind quite different to what I was usually practicing and what I was usually doing. It took me a moment of like thinking about it to then go, you know what, like what do they have to lose? They're going to be healthier and we're going to, kind of support the process. And what surprised me was that they were doing IVF because they had challenges conceiving, but mostly also because they couldn't actually have intercourse. They were having major difficulty having intercourse because they both had different conditions. And when we optimized their health and did all the things that we needed to do for them to actually be more fertile, they actually ended up conceiving naturally. So it was this whole kind of double whammy situation where not only we improved their chances of getting pregnant, but also their ability to have intimacy. So all that to say that, many years went on and I started to decide that, okay, I really want to now really focus the attention that we place on couples who have been infertile or have had difficulty through various different treatments and have tried lots of different things that hadn't worked. And so what ended up happening is that we shifted the types of patients that we treat very much to, people who were infertile for at least 2 years, experienced miscarriages, or had failed treatments and nothing was working. And so then by the time, fast forward 15 years later, by the time I actually went to Harvard, did my master's in public health, and my practicum, my thesis was about our program. And essentially we did a study to figure out our success rate and the things that, essentially work there. And we discovered that the average number of years that the patients that we treat were infertile for was 4 years. So then I realized, that, okay, we really do specialize very deeply on couples who are having difficulty, who have tried lots of different things and really haven't had the success that they wanted via typically various failed IVF cycles and, a whole lot of different difficulties. So all that to say that, similar principles that you would apply to optimize fertility if you've only just started trying or if you're considering start trying, is that you also need to have in place to do and to improve and to optimize when you are having difficulties. The only difference is essentially how those things are applied and also getting clarity on the why that those people need whatever it is that they need at that point in time. Because let me give you an analogy. Let me give you an example. Like let's say you go to your dentist, or I say this to my patients, let's say you go to your dentist and your dentist tells you you've got a sore tooth, right? And you have a sore tooth and he says to you, just brush your teeth. That's going to be fine. That's going to be okay. Just, keep brushing your teeth. All is well. And you're kind of like, well, I'm not sure about that because, I kind of have been brushing my teeth, and let's equate that to lifestyle. A lot of people talk about how important it is to have a healthy lifestyle, to eat well, to have the right diet, the right exercise routine, the right this, the right that, all of that. Those things I always recommend that people have a good foundation to optimum health. And certainly to me, that is the same as kind of brushing your teeth. Yes, oral hygiene is really important. Brush your teeth, right? But if you have a tooth pain, brushing your teeth is probably not going to fix a tooth pain. You've got to get to the bottom of what it is that's causing that tooth pain. Then let's say you go back to the dentist and, you say, hey, listen, you told me to brush my teeth. I've been doing that. It hasn't worked. What do you recommend? So they go and say, well, we've tried that. Let's put a cap on it. We'll just kind of, we'll put a cap on that tooth and it will be good to go. And you go, okay, but why are we putting a cap on it? Like, what's happening? What is the reason? Like, what is the problem that I have that makes you think that I need to put a cap on that tooth? Oh, don't worry about that. We can bypass that by just putting a cap on it. That's the same as going to IVF, right? And kind of going, let's just put a cap on it. It's all going to be fine. You go, you put a cap on it, and lo and behold, you still have pain. So you're kind of like, well, hang on a second, what's happening? Oh, let's fix the cap. Let's do this to the cap. That's fine, but you still have a tooth pain. So I guess, like the way that I describe it in terms of like what needs to be done is that piece in the middle of figuring out, okay, why do we have that pain to begin with? Like, Is it because we have a nerve damage, an exposed nerve? Do we have an infection? Do we have a cavity? What is happening? Why is it that that particular tooth is feeling pain? Is it because it's cracked? Is it because it's getting some kind of exposure that's, worsening it? Is it because you have something that's rotten right there in the middle? Who knows, right? Like, the point is that we need to figure out what is it that's causing that issue, because unless we do the best thing to fix the wrong problem in the best possible way. And that is why people stay infertile, keep trying and going around in circles, typically for years, before they really get the help and the support that they need, because they don't understand what it is that they're dealing with, because they keep being told, hey, brush your teeth, or hey, just put a cap on it and everything's going to be fine. So
yeah,
the challenge,
the root cause resolution. And I think even to the next level, when you have couples who, let's say, have started the fertility journey with a traditional medical practice, and they get diagnosed with something to say, this is why you're having infertility. Let's say it's PCOS or, low sperm count or whatever. Then still the solution is, well, because you have these issues, we need to do IUI or IVF, right? This is how we fix that problem now that we've diagnosed you. And I think what you and I are talking about is having any symptom and any diagnosable disease can be reversed with make changes in your life. And when you do that and have a healthier body, those diagnoses and symptoms will probably, go away, and then a baby is conceived.
Yeah. And, sometimes what's interesting about what happens for so many couples is that very much, and this is a healthcare system issue, right? Because very much what happens in kind of general public health is that the memo is, let's do the absolute minimum for the biggest number of people, right? So what ends up happening is that we know that even though some couples struggle with infertility, 1 in 6 couples, and there are lots of challenges associated when you are going through that difficulty, it is tough, and it's tough on every level. It's tough emotionally, it's tough physically, it's tough financially, it's tough relationship-wise. Like, there is not one aspect of a couple's life and an individual's self-concept that infertility or miscarriage, i.e. reproductive challenges, don't affect, right? It affects the entire gamut. It affects the relationships with the partner, with the family, with, you name it. So the thing about it is that for the individual, it's a really, really difficult problem to solve. And on a population level, it's an ignored problem to solve, right? It's not important. And what happens because it is given no priority is that you will go to a doctor, and the doctor is given a very basic guideline. If you are in a universal healthcare system, like, for example, we treat patients in every continent other than Antarctica. And so what happens is that we see healthcare systems around the world trying to tackle this problem, and they don't do a very good job. Because the guidelines that are international guidelines about infertility, they basically say, if a couple comes to you and they're struggling to conceive, there are 4 things you need to find out. Is there a uterus? Is the uterus working? Do we have fallopian tubes? Are they clear? Is there ovulation? And is there sperm? It's pretty much that, right? And I often see patients who come to me and they even haven't had a semen analysis. The couple, they're flying kind of blind as to what is it that's going on. Now, in those 3 other things that are checked in the females, and mind you, the STIs will be checked, and it will just kind of be this kind of very surface level understanding about what's going on. And the second that those results don't show anything, because for the majority of people who are struggling to conceive or keep a healthy pregnancy to term, those results are going to be pretty useless. It's like most women trying to get pregnant, they're going to have ovaries, they're going to have uteruses, they're going to have clear fallopian tubes. So, that is kind of like the same as saying, it's blue sky out there. Should we look for, where it's bluer? Like, it doesn't really add to the conversation about what else is going on here.
It's so basic.
It's so basic.
Like, if you don't have a uterus, then you will not be able to have a baby.
But you see, it even goes beyond that, which is this. You go and you have those tests done. Do you have a uterus? Yes. Oh, good. Then everything is normal. So you go, hang on a second. But I have not been able to conceive and or keep an embryo developing in said uterus. So how can that be normal? You know, I often say to my patients, it's like the only normal is if you want to be holding your baby and you are. That's the only time where this is going to be normal, right? Any variation of you are wanting to hold a baby, your own baby, and you're not, and you have done tests and the results are within the reference range, that does not mean normal. That does not mean that everything is okay. Because what couples hear the most on this journey is, oh, we've done all the tests, everything is normal. Okay, so where's my baby?
Right.
Because if everything is normal, that's really what I should be seeing, right? And therefore, it's really kind of taking a step back and going, okay, so then where are the gaps? Where are the places of opportunity? Because if we're looking for what is normal, and it's really very basic, it's in front of us, then we need to start asking, and we don't have a baby, then we need to start asking, okay, well then what is abnormal? Like, let's find the abnormal things and how do we address them in the best possible way, in the most effective and direct way, so that we can overcome this challenge that clearly we are experiencing.
Right.
Because otherwise we would be having a baby.
That's
Makes
right.
sense?
So I think a lot of these couples doing IVF and IUI have this like unknown for infertility, right? Like you said, there's nothing been diagnosed in either partner, and they're so confused because they're still having challenges. So what are some of these lesser known factors that are creating fertility challenges that people that they don't even know is an issue?
You see, it's interesting, and that's a really great question, because what happens is this. First and foremost, and this is something that is categorical, unexplained infertility, unexplained miscarriage, as far as I'm concerned, is a cop-out diagnosis.
Sure.
It is like just a lazy way of saying, or an acceptable way of being lazy, right? Or literally just basically, and this is, I'm talking about the clinician trying to diagnose it, because like seriously, if you're going to just tell your patient that unexplained, well, then go find out a way to explain it. Go do more tests. Go figure out, okay, what else is there? What are the other areas that we need to look at? What are the things that have not been looked at? You know, like it's not magic. It's about being systematic and methodical about what are the things that are getting in the way. And sometimes it's not even these lesser known things. It's actually just doing the basics really well. Like, for example, you get 10 men lined up. They all have, some kind of sperm morphology issue. Shape of the sperm is not how it needs to be. That's one thing, and that's an important thing to understand. But the problem isn't so much about understanding and uncovering the issues, is then knowing how to address the issue as well. Because for the 10 men that all have low sperm morphology, you can have 10 different reasons as to why for that man, that's showing up. You know, for somebody, it might be that they have a lot of exposure to toxic chemicals. For another man, it might be that they're sitting on their testicles all day long. For another one, it might be that they're 50 kilos overweight, 100 pounds overweight. For another one, it might be that they smoke all day long. For another one, for another one, they keep a mobile phone in their pocket. For another one, they're doing, so it can be so many variables and varieties of reason as to why that thing is happening. So for example, then you have the test, you find out that, okay, this is wrong. But you're then not really asked very specific questions to figure out, okay, so for me, how do I address this problem? Because for one man, it might just be that they're eating McDonald's all day. right? And they're not having enough antioxidants, and they're having a lifestyle that's not ideal. And so like that, there are many permutations on the same kind of theme of trying to not only diagnose the problem, but diagnose the reason as to why that's happening. Because I often say, like whatever outcome we're experiencing, whether it's inability to conceive, inability to keep a pregnancy to term, sperm quality that doesn't look how it needs to be, whatever it is, those are all outcomes of many biochemical chain reactions that happen way before that outcome is actually seen, right? So we need to be able to understand and disentangle the pieces in the middle that are causing this outcome, because otherwise we will just keep repeating more of the same. And when we're talking about the outcome that we're seeing, IVF wants to address it literally from the very closest possible path to that outcome, which is get the egg, get the sperm, and put it together, get an embryo, insert it in. But here's the thing, 70% of IVF cycles fail. So how useful is that really in the grand scheme of things when we're not understanding why we are dealing with these fertility challenges or miscarriage challenges, and we think that we're going to bypass an entire life of exposures by just getting an egg, getting a sperm, and putting it together and transferring that embryo. And on the other side of this, piece of news, I guess, is the fact that when you do transfer an embryo, you have a pregnancy in place. Like that person is pregnant in the moment that transfer occurred. If that person sees or does not see a positive pregnancy test, that is an entirely different conversation. So then we know that there is basically implantation failure, if not a chemical pregnancy or a miscarriage down the track. And then the question really is, okay, we see the outcome, but why? Why did this happen? When did the failure happen? Was it because of, male factor? Was it because of female factor? Was it because of an idiosyncratic factor? Was it because of embryonic factor? So, again, these questions, in my opinion, and certainly in my clinical experience, often are not even asked so that they can get answered. They just get dismissed. Couples just get told, oh, bad luck of the door. Luck, what is really luck?
It's so disempowering, right?
Go again, It's why do we keep doing the same thing? We're expecting a different result. We're just going to get the same result.
All the things you listed about the male sperm morphology, all of that to me was so common sense, but there's a reality that a guy could be doing something and not connecting that behavior with his sperm morphology, right? And so when you ask these questions, you link it. And then it's empowering this guy because he's like, oh, I don't have to keep my cell phone in my pocket. Or, you know what? I've been wanting to quit smoking for a long time. This is a good, and I want to have a baby. And, I think like, especially guys, they really don't necessarily put the culturally the pressure isn't like you have to change your lives and you have to drink less and smoke less and eat healthy, like because you're the guy and you're not getting pregnant, right? But we know this does impact fertility.
Absolutely. And, 50% of the reasons as to why miscarriages occur are to do with male factor and sperm factor. So
the pregnancy occurs, but it's not a healthy pregnancy because of these epigenetic factors.
It can be epigenetic. It can be literally central genetic because of essentially the fact that this person is, has DNA fragmentation or has, a whole lot of different things. So, what's the most interesting thing that I think couples do need, and in our society, and especially through the IVF process, I think that men are really not given the respect, quite frankly, that they should be. And women on the other side of that, I think, are also not given the respect that they should be. Because like I said, how is it that we're trying to fix a problem like infertility that we know takes egg and sperm by just addressing one side of the equation and trying to put all of the onus of that situation on one piece of the puzzle? Or one piece of that equation. It just doesn't work like that. And when men come in, often, typically to my clinic, when men come in, they are either in one or two camps, right? They're either really annoyed that they have been asking for all this time. Like I said, a long time that couples that come to me typically haven't conceived. They've been asking for all this time, what is it that they can do to improve that couple's chance of conceiving and taking home a baby? And they've essentially been told, no, there's nothing you can do. Or we can bypass that with IVF, right? They're either in that camp where they're like, this is just BS, right? Or they're on the other camp where they don't even know what they don't know. And they're still believing the story that fertility is a woman's issue.
Right. It's an old story.
Absolutely. And so there's an entire conversation and piece of education that needs to happen for them to understand that, hey, actually, if both of you are as healthy as possible, as a couple, you have a better chance. What's really interesting is about how the egg is responsible for fixing a lot of the DNA fragmentation within the sperm. So what happens, during fertilization and the whole conception dance, so to speak, is that the egg releases chemicals that attracts to it the sperm that most complements its own DNA. So that's how that whole fertilization piece happens, right? So there's
fascinating.
There's almost an aspect of attraction for that particular egg and that particular sperm. So it's kind of like dating on a micro level.
That's really cool.
But what happens with that, and of course, through ICSI, that entire thing gets bypassed altogether, which that generates a whole lot of other questions. But, let's just imagine that you've got that egg and that sperm and they're kind of going through that process. The sperm that enters the egg, ultimately, it's going to have to work with that egg in the best possible way. And DNA fragmentation is one of the issues that the egg actually needs to work to solve. Now, if a woman is experiencing, whether it's low ovarian reserve or, poor egg quality, what's going to happen is that the energy production capability of that egg, the mitochondria within the egg might be impacted. And it might not be able to do all of the work to fix that DNA that it normally would be able to do if other variables are in place. If it was a different time and a different place and a different situation altogether, say at peak fertility compared to much later down the track, right? So regardless, that egg still has to do the best that it can to try and get that sperm and its own DNA to become an embryo and for that embryo to then begin to develop. If the errors are too great and the egg doesn't have the energy to be able to do that, what happens is that pregnancy fails from before it even begins. Right? However, sometimes the egg can continue that whole division process happening and it won't fail. But sometimes it will fail when you see a pregnancy test. And, a few days later, it's no longer there. And sometimes the errors are so great that a miscarriage might occur at 9, 10, 12 weeks. So, that really is something that, again, yes, we can try and ignore it. And yes, we can try to just, keep trying and just hope for the best. But if we understand these concepts, we can just as well go to the beginning of the process and figure out, okay, well, what else is it that I'm doing or not doing, that I could do to optimize the situation? Now, when people ask me often, what are the things that you recommend couples do to improve their chances? It's very simple. I say, act pregnant now to get pregnant later. Right. And I actually recommend both of my patients do that. I know that the men often are like, oh, what does that even mean? Well, imagine that you could be pregnant. And in fact, you are already holding within you 50% of that little baby that you want to create. With that being the case, already you have the potential to influence what is happening within you and what will happen in a future pregnancy. So by acting pregnant now, what are the things that you would absolutely start doing or you would absolutely stop doing if you were pregnant in this moment? Those are the things that you absolutely start doing and you absolutely stop doing right now, even before a pregnancy is in place. Right. And that might not be everything that you start and stop doing, because remember, we have to brush our teeth, but we also have to figure out what is actually causing the tooth pain, if this was the dentist scenario. And so that's really what we need to have a look at. It's all of those components together, because that's really what makes the change happen. I like the saying, you've got to change. And that is very true when it comes to fertility.
Right. Well, especially like you said, if somebody's been doing something for years, their lifetime, and now they're understanding, I have to do it differently. I mean, that can be hard for people, right? To make those, especially if it's multiple things that would be beneficial for change. So when you're working with a couple, how do you support them in making these changes?
It's a really great question. And I usually look at what can you stop doing? Because often, when people come to me, by the time they come to me, they are doing so many things. They've been to this person and that other person and this other person. And, they've been implementing, they've been aggregating lots of things that they've started to do because they were recommended to do them, or because they started to go online and figure out things that they need to do and whatever else. So really my very first step is to look at the entire picture and go, okay, what's actually useful here? Right. So that's my first question. And really, I'm asking that question based on first understanding their entire situation. Where are the gaps? Where are the places of opportunity? That's my first place to go. And once I then go there, I then go, okay, now that I understand that, what are the things that are going to drive me to the outcome that I want to create? Because if I don't know, I had a great example. This happened in my own house. I had a leaking toilet once, and, I called the plumber, they came, they fixed it. Then 24 hours later, it was still leaking. I was like, this is weird, because they left and it was okay. Called them again. Long story short, called them 3 times. Then the third time they tell me, we have to remove tiles from the wall. I'm like, okay, that's where we stop this little game, because I have no tiles to replace whatever it is that you're going to remove from the wall. So we need to really be sure that this is actually the case, that what you're telling me is actually the problem. And so in the end, they couldn't guarantee that it was going to be the problem. So I said, listen, just leave the toilet off. Just leave it off. I'll come back from holiday. I was going away for a week. I'll come back from holidays. I'll deal with it when I'm back. And when they took the toilet out, I could see on the floor that there was water, a puddle of water underneath the thing. And I'm thinking, gosh, where is this water coming from? I could see that it wasn't coming from the wall that they were pointing to, whatever. I didn't really know. So I went away, came back. There was no water. Everything was completely dry. So I'm thinking, okay, that's interesting. Went to have a shower. Then all of a sudden, I see the floor just bubbling up. And right there and then I realized that I didn't have a toilet leaking problem. I had a shower that was not waterproofed. So it was an entirely different problem. It wasn't just going to take $3,000 to get this fancy machine to come and diagnose the problem that wasn't there. And it wasn't just going to take taking a couple of tiles off the wall. It actually took an entire bathroom renovation. But at least I knew, and it didn't waste time and annoyance and frustration and an extra $3,000 that I could have put to a brand new sink or toilet or tiles or whatever, right? Or to a college education fund. So, it's really interesting, because often we look at things on face value and we go, oh yeah, that must be the problem. That's the most obvious thing. And sometimes the most obvious thing isn't necessarily the case, that it is the actual real problem. And sometimes it is. So how do you discern? Right. And I think that it's in that discernment piece of really being able to observe, and obviously having the experience that we now have of, almost 25 years of doing this work, we can really very quickly look at things and go, okay, for this particular issue, we still need to ask these 10 questions that haven't been asked. And of course, that's going to depend on each person, each case, each situation. And that's why the process is so customized, because not every person is exactly the same as another.
Yeah. I think that is really it's that questionnaire, it's that digging deeper. And it's enlightening for both the practitioner, but also for the patient, they like, once again, they might not connect that this thing that they do on a regular basis is actually negatively impacting their fertility, right? They don't see that connection until the question is asked. And then it's like an aha moment for them to make a shift.
Yeah. Absolutely. And also I think, there's another layer to this as well, which is really fascinating, which is this whole idea that, often people kind of look to the side on the right and on the left of themselves and goes, well, this really simple thing can't possibly be the issue because this person drinks, smokes, does drugs, and is still having a healthy baby. So why do I have to change all of these things that, are happening in my lifestyle or my life and are affecting me? Or, I doubt that it's affecting me because it's not affecting them. And to that's where epigenetics really comes in. The whole idea that we've all heard of stories of people who have never smoked a day in their life and died of lung cancer, or that person who basically was a chain smoker and never had any issues whatsoever in their respiratory system. And so you start to question, hang on a second, how is it that that's true? Because look at those people, they have 10 children and they do all of these wrong things. Because you see, what happens is that not every person is affected genetically and epigenetically in the same way. The environment will trigger in one person one set of cascade of aspects of what might actually show up in their kind of like outcome. And for another person, it might be something completely different. So again, I think that it's also important for us to realize that just because it wasn't a problem for your mom, your brother, your sister, your grandmother, it doesn't mean that that thing isn't involved or somehow associated to the issue that you're experiencing right now. And that's why people have real difficulty correlating, right, their actions and behavior to their outcome. And in some cases, quite frankly, it's actually quite impossible to discern, because what happens is that, sometimes you just have to make a whole lot of choices that approximate that person to ideal behavior in their life without really knowing exactly which one of those things is going to make a difference, so that you can improve a whole lot of areas that you would not be able to access improvement otherwise, right? Because sometimes these changes are so minute that they can't be perceived by just kind of how you feel from one day to the next, right? Like, for example, how you sleep will affect fertility, but how does it affect fertility? Is it just because I'm going to be tired the next day? No, there's a whole lot of biochemical chain reactions that happen within the system that trigger and balance or imbalance different kinds of hormones that will impact how your body actually responds on a day-to-day and on a month-to-month hormonal basis, right? So those are the things that sometimes, like, it's impossible to disentangle. So we've just got to do the best that we can with the knowledge that, okay, it's like getting fit, right? You know that you're going to have to repeat that action or whatever it is that you're doing, going to the gym, getting on a bike, doing a spin class, whatever it is, you're going to have to repeat it frequently and vigorously and, consistently. Because if you don't do that, you won't get the improvement outcome that you are looking for. And you also know that it's not going to happen by you doing it once or twice or for a week or for a month. You have to actually almost kind of commit to a change before you can see it, right? And the reason that's important is because of the egg maturation cycle and the sperm formation cycles. Because what happens is that, women, and again, this conversation might be completely different in 20 years from now, but women, we are born with all the eggs we'll ever have at this stage, right? Stem cell research, whatever, we might have a very different conversation in another 10 years, Laura, but right now that's just how it is, right?
More eggs are coming down the pipeline?
Yeah, more eggs apparently are coming down the pipeline. So, but the thing is, right now, we know that, okay, we're born with all these eggs. These are the eggs that we're going to be maturing throughout our lifetime. And so basically, We also know that they have 2 maturation cycles. From primordial follicle to primary follicle, there is 1 maturation cycle. From primary follicle to ovulatory follicle, there's another. The first one takes, let's say, anywhere between 4 to 6 months. The second one takes anywhere from 5 to 7 months. So really, that from the time from primordial follicle to the follicle that was ovulated, say this cycle, there's about a 12-month window in that, right? So if you are going to do all the things that you're going to do and you're going to optimize your health and those maturation cycles, you're going to be affecting the last cycle first and the second cycle last, right? Because you're going to see an effect that happens from the second maturation cycle onwards. And then as you continue the process, you're going to see the beginning follicles start to also be affected. But the reason that that's important is because you can't just do something. You can't just go on a diet for, 6 weeks or 8 weeks and go, okay, well, my eggs should be better now because they're not yet. Right. There's a whole lot of improvement that needs to happen. And some people do not have 12 months of improvement before they run out of time to have a baby. So then that's where you've got to figure out, okay, what are the very specific strategies and the things, where are the quick wins, right? And again, that will be very different for every person.
Yeah, it's customized.
Absolutely. And the sperm maturation cycle is a bit different. It's about 3.5 to 4 months. You're getting new and fresh sperm all the time. Now, obviously, if the environment that sperm is developing in is not quality, you're going to end up with a terrible end product. It's just how it is. Right. So if it's full of toxins and instead of nutrients, we have chemicals, and instead of, all the things that you actually need for the sperm to mature properly, you just don't have those building blocks that are going to show quality at the end of the process. You're going to end up with sperm that don't look good under the microscope. You're going to end up with sperm that contribute to miscarriage. You're going to end up with sperm that contribute to infertility and don't contribute to egg quality issues. It's doubly important, as I said, if there are egg quality issues, that we really optimize sperm. So that's where we really need to have a long-term view, a medium and a short-term view. It's not enough to have a short-term view on a really long-term situation like this one.
Right. It totally makes sense. And what about chronic stress? How much does that play a part in fertility challenges?
Look, often I get asked, patients ask me, I'm stressing about stressing.
They're stressing about not getting pregnant, right?
And they're stressing about stressing that's going to decrease their chances of getting pregnant. So they're stressing about the stress that they're feeling about the fact that they're stressed about fertility, right? And for those people, I recommend don't stress. I know it's easier said than done, right? I know that it's feels like you want to give me a slap in the face, but refrain, because here's the thing. I think that the most important thing that we can do is, in terms of that, is to contribute to our happiness in the moment, right? Is contribute to how we feel in terms of ease and decreasing that kind of angst as much as we can in the moment, because there is nothing we can do about stressing about the fact that we're stressed or about the fact that we're not getting pregnant. It's about really figuring out, okay, how can I support my hypothalamus pituitary ovarian axis that regulates that whole stress response and hopefully decreases our cortisol at times that it doesn't need to be up, high in the air. How do we actually get all of that to decrease and balance, So I much rather that people, rather than focusing on the fact that they're stressing and stressing about the fact that they're stressing, I recommend going for a walk, going to meditate, going to do some exercise, essentially inserting activities that gets their mind off. Because, one of the things that the body is incredible at is self-regulation. So you remove the obstacle from what's happening in that moment, and all of a sudden the body can actually get back to homeostasis really beautifully, quite quickly, right? It's when we continue to focus on the problem that we have that we can't fix, that then it continues to escalate. And those hormones mimic that anxiety and that stress response that we continue to perpetuate. So often I say, you know what? Pay absolutely no attention to it whatsoever. Go learn to paint in watercolor. Go and do a run in the park. Go and go to a spin class. Go breathe. Do breathing exercises. Do stretches. Do a meditation. Whatever it takes to just get the body to self-regulate and be in a place where it actually feels comfortable. Because the more that we can do that, and the more that we can transition from one activity to another that feels pleasant to us, the better our baseline decrease of those stress hormones actually is, and the more that we actually support our fertility rather than work against it. And there is a lot to be said for vigorous physical exercise and activity when we are feeling, this kind of stress, but also listening to your body. If you feel that today you need yoga, by all means, go for it. If you feel that you need a breathing activity, do that. If you feel that you need to just, have a hug, go and talk to a friend, then engage in that activity. I think that sometimes we tend to overcomplicate something that actually our body knows how to do really, really well, which is to self-regulate and self-soothe.
Right. It's so true. Gabriela, I know we have to wrap up today's episode. Do you have any last thoughts you want to share with the audience, and how can people find you?
Sure. They can find me by Googling my name, Gabriela, GabrielaRosa, or they can go to my website, fertilitybreakthrough.com. And those were the two kind of easier places to go. The one thing that I want to say is that, trust yourself, trust your gut. Right? If you have the sense that you shouldn't do something, that thing is not going to get you to where you need to be, listen to that. And above all, don't listen to it's a numbers game, just keep trying. Everything is normal, just keep trying, because that is going to waste you a whole lot of time on your journey to parenthood. We do complimentary fertility assessments for people who might want to discuss the situation. So I highly recommend that people kind of jump on that if that's something that calls to them.
That makes so much sense. Well, Gabriela, thank you so much for coming on the show today.
My absolute pleasure. So good to be here. Thank you for having me.
Well, I hope you liked today's episode. Gabriela was a wealth of knowledge for any couple who is interested in fertility, and especially my favorite topic, preconception, and really all the things that you can do before you start trying to conceive a baby that can not only increase your fertility and recurrent miscarriage risk, but also really to thrive during your pregnancy, have a full-term pregnancy and an empowered birth experience, because you're in a healthier state, physically, mentally, emotionally, spiritually, you and your partner, than before you did the work, right? So this is so important. I love how Gabriela covered some topics like lesser known facts of infertility, how chronic stress and its physiological impact on fertility is a real thing, and the most critical hormonal imbalances that can interfere with a couple trying to conceive a healthy baby. So once again, if you want to learn more about her clinic and how you can work with her no matter where you live in the world, go to her website at fertilitybreakthrough.com, FERTILITY, breakthrough, BREAKTHROUGH.com.